Hello, and welcome to the Bachelor of Midwifery Program virtual tour. My name is Susie, and I'm a second-year student in the program. I want to highlight some of the amazing spaces available for midwifery students here in the program. We're standing right now in the Helen Glass Atrium. The midwifery program is physically housed in the Helen Glass Center for Nursing building and has its own unique identity within the Rady Faculty of Health Sciences. In this area is the administrative offices. Here is where the dean, associate deans, and directors of programs have their offices. Down this hallway is where you'll find the offices for the student advisors for all the programs. The midwifery program advisor has an office here. The student advisor is there to support you before you get into the program and while you're in the program. They answer questions related to the courses, supports, policies, and many other things. You can book an appointment online for a midwifery student advisor via our website. Over here is the Student Association office. Currently, the midwifery students are working towards forming a student association, but have been integrated in the existing Nursing Student Association to work on midwifery-specific events. Over here is our reception and student services desk. Persons at this desk are there to support questions you might have or help guide you to the right information while you are a student. Across from the reception and student services desk is the undergraduate midwifery and nursing student lounge. It's well equipped with seating, tables, microwaves, and a refrigerator. If you are on campus for most or some of the day, you have a place to hang out, eat, and store food. There is also a washroom in the student lounge. Midwifery students will do some of their simulation practice at the Bannatyne campus and have the opportunity in the Human Reproductive Physiology course to participate in learning in the state-of-the-art facility, the Dr. George Lee Laboratory of Anatomical Science. But most of the classroom and clinical learning in Year 2 will be at the Helen Glass building. On the 3rd and 4th floor, there are common lounge spaces where you can relax and study between classes. And then on the 4th floor, there is a dedicated classroom for specifically midwifery course delivery. Room 415 has a main classroom with up-to-date technology that allows for hybrid learning. In addition, there are pods that are used as clinical spaces for some of the clinical learning. Year 2 of the program is in the classroom. In Term 1, students take a preparation for midwifery class as well as human reproductive physiology. 2 of the courses, Human Diversity and Evidence-Informed Practice, are interprofessional and are taken with nursing students. These courses might be delivered in one of the larger seminar rooms that you see here. With the Clinical Skills course in Term 2, the students will participate in hands-on skills simulations to prepare for their first clinical course called Normal Childbearing Practice and Tutorial. In Clinical Skills Lab, the students get the opportunity to learn basic skills such as a head-to-toe physical assessment, IV and injection skills, management of labor and postpartum, emergency skills, neonatal resuscitation, physical assessment of the newborn, and much more. Throughout the program, students will participate in simulation and clinical labs to prepare them for their clinical courses that begin in Year 2, Term 3, until they graduate in Year 4. These simulation and clinical labs are done in the maternity simulation room and other clinical lab space. The program incorporates realistic simulation to prepare us for clinical placements. In Year 2 and 3, the students spend most of their time in clinical practice out in the community in rural, remote, and urban settings across the province. A unique aspect of Year 3 is students have the opportunity to do interprofessional placements. These placements are intended for the student to learn about different health provider roles as it relates to maternal and child health. Throughout the program, students are required to travel to these placements, and their clinical site is assigned by lottery to ensure it's an equitable process for all. Rady Faculty of Health Sciences has a unique program that helps support students financially for this travel. In Year 4, students are in the same midwifery for both terms to allow solidification of your skills and prepare you to enter the workforce by the end of Year 4 as a new registrant. Well, that wraps up our tour. Hold on, I got a phone call. Oh, I gotta run to our birth. Be sure to check out our website or book an appointment with our midwifery student advisor if you have any questions on our admission. Bye-bye.